Let me first invite Deepak Mishra, who is joining us from Germany. Deepak has done his MBBS from BJ Government Medical College, Pune, India. Afterwards, he worked as a gazetted medical officer for Government of Maharashtra. He has also served in different hospitals in Delhi and Pune. Before moving to Germany, he has worked in Chicago, USA. Since 2015, he is in Germany and working as resident surgeon in orthopedics and trauma. He also works as Notarzt. In English, we call emergency doctor, in German, Notarzt, for the city of Essen in Germany. Deepak is founder and owner of a consulting company in Germany called 𝗵𝗵𝗹𝗁, which provides training and career consulting solution for international doctors, dentists, and nurses in Germany. It is interesting to know that only with PhD degree you are allowed to write DR in front of your name in Germany, like usually in India we write after MBBS. Deepak, may I request you to explain how the medical system works in Germany? Please also clarify the terms, some German words, Hausarzt, Facharzt, Einweisung, Überweisung, Meldebescheinigung, etc. So Deepak, please.
Dr. Gautam, thank you very much for inviting me to this wonderful session. I'm really privileged to be amongst honorable guests that you have, the esteemed honorable guests that you have. Yes, I will do my small bit to share these terminologies that specifically the foreigners in Germany find difficult, and that is the reason they are many times eluded of the medical health services over here. Because it's not a fault. I mean, there's a communication gap between the caregiver and caretakers, and it's understandable. I work myself as a doctor here since 6 years, and I also come regularly across people who don't understand the words that a doctor says. So that's why I will take this opportunity to present in very brief about the healthcare system in Germany. We will go further. We'll talk about what are the names of the establishments in Germany. When we talk about, like in India, we have a private practice, a doctor's clinic. So it is also called praxis over here. The hospital is called, there are different types of hospitals. One is a Universitätsklinik, that's a university hospital. And one is a Kommunalkrankenhaus. Kommunalkrankenhaus means the community hospitals. We hear these words in American context, community hospital, university hospitals. But here also the meaning is the same. When there is a clinic in front of the name, it is called a clinic. I mean, it's a hospital, and clinicum is a bigger clinic, bigger hospital. Reha clinics is a rehabilitation center. Pflegeheim is a nursing home or old age home. I mean, in India, when I was working in India, we did not have much reference or many people coming from old age homes, or sort people coming from home where they lived with their families. But here, since the demography is different and the social system is a little different, many people after a particular age live in old age homes, and we get patients regularly from old age homes. Kurzzeitpflege is a term which one uses, for example, there's a patient who has a fracture or something. Okay. Now I take always orthopedic references because I work in orthopedics, so other references don't come directly to mind. For example, people who have accidents, fractures, who are treated, operated, they are supposed to go to the rehabilitation center. Okay. But for rehabilitation center, they require to be fit for rehabilitation, fit for physiotherapy. When people are so frail and so delicate that they cannot go to rigorous physiotherapy or rehabilitation, they need some time gap. Now this time gap can either be at home, but as I said, the demography is different. There are many old age people who live alone, and somebody who is 85 years old and cannot live alone in that debilitated situation where one already has a fracture, is operated. For that, there is a short-term care facility. That this Kurzzeitpflege, this works as a bridge where one does not need to go home, can go to the Kurzzeitpflege, and from there, after a few weeks, will be shifted to the rehabilitation center. Now, then comes the Pflegedienst, the ambulatory nursing care. Now, this is also a very good system, which I find I always contrast and compare this to the Indian system because of my experience in India and Germany as well. Here, if someone is old and cannot go to the hospital every day, cannot go to the house arts, the family doctor every day, then there is this ambulante Pflegedienst. Ambulante Pflegedienst means, and everything what I'm talking about is Kurzzeitpflege, one has to pay for by themselves, but other things are under the health insurance. So this ambulant Pflegedienst is that the nurse will come to the house of the patient and will take care of the wound or take care of the whatever is required. If the washing is cleaning is required, so everything will be done by the ambulant Pflegedienst. Medicine giving, injections giving, all the things can be done by the ambulant Pflegedienst. Now we'll go further towards the system of 112. It's a 112. It's an emergency medical service. It is called Rettungsdienst in Germany. Now I will go a little bit into the idea of Rettungsdienst. Here what happens is that we see in movies and all about the 911 in the USA, where the paramedics go to the accident spot, or if any, in case of many medical emergencies. Here 112 is the Rettungsdienst. That means there's a central office. And then in case of any medical emergency, people call that 112. They tell their emergency, what is the condition, what is the problem. And then the person sitting over there at 112 office decides that this patient requires a paramedic help or also requires a doctor's help. Now, if the only paramedic's help is required, then they will dispatch the paramedics teams, the Rettungsdienst to them. And if a severe case is there, then a doctor, a Notarzt will also go along with the paramedics team. Now they don't go along; they come separately. Like the doctor's team is different and the paramedics team is different. Sometimes it happens so that the paramedics reach over there and they seem that okay, things are beyond their hand; they cannot do much about it, so they need a doctor over there. Then they call the Notarzt, the emergency doctors, and doctors mostly in most places in Germany, doctors reach within like 10 minutes time to the, and these doctors, Notarzt, are trained in management of all kinds of emergency, all kinds of medical emergencies, ranging from trauma, accident to heart attack to lung problems. So you can see here what we have, what problem we face as doctors is that as a Notarzt, when I work as Notarzt, that many people don't understand the difference when they should call the Notarzt and when they should go to the hospital, a simple doctor who is not a Notarzt. Now, the cases of emergency, like signs of heart attack, that means like severe chest pain, shortness of breath, cold sweat, signs of stroke, like blurry vision, impaired vision, signs of paralysis, or there are accidents with high blood loss. If someone has fainted because of unknown reason, in case of allergic shock, anaphylaxis, severe pain, severe burns, asthma attacks, so anything that could be life-threatening, in that case, the public is supposed to call 112. Now, for smaller things, which are, for example, chronic pain, when someone has pain for months together and now it's a little bit increased. So for that, one is not supposed to burden the 112. One is supposed to call 116, 117, 116, 117. This is called Ärztliche Bereitschaftsdienst, that is a Notdienst. Now, these are also doctors, but these are not Notarzt. These are normal in cases of, for example, cold, flu-like infections, nodes to ENT infections, GI problems, migraine, back pain, so which are not life-threatening. For that, one has to call 116, 117. Okay. So many times people confuse that, not only the foreigners who are unaware of the system, also people who are aware of the system, just because the Notarzt system works very fast and very efficiently. That's why it is overburdened, and then that is a misuse of resources, I would say, in my terms. Now we'll talk about the terminology. When a patient is in the hospital, he visits a hospital in an ambulant situation. Ambulant means in a OPD basis. Then he gets an Arztbrief. Arztbrief is that his chief complaints, his problems, his diagnosis that has been done, the treatment regimen that is prescribed, everything will be written on that Arztbrief. When one goes in the Stationäraufnahme means admitting the patient, so inward patient. Then after the completion of stationäre Aufnahme, every patient is entitled to an Entlassungsbrief. Entlassungsbrief is a discharge summary. Now, this discharge summary is very important because this will be taken further to the Hausarzt, to the family doctor, who will take over the recommendations made by the hospital, that what medicines have to be given, what tests have to be done, in future further tests, that has to be taken by the Hausarzt. That's why this Entlassungsbrief, the discharge summary, is very important and everyone should get one. Verlegungsbrief means transfer certificate, transfer letter, the referral, that one hospital is not able to manage certain things, it has to be referred to the higher center, the Verlegungsbrief will be there. Rezept means the prescription. Kostenübernahmeantrag, that means certain things are not taken care by the insurance. Now, for those certain things, one has to, or unclear if the insurance will take care of them or not. So instead of directly going through treatment and later on having the burden of the payment on oneself, one has to go and do this Kostenübernahmeantrag by the insurance, so that the costs of those treatment or those things can be taken over by the insurance. The Einweisung is that when a family doctor refers one to the hospital for admission, basically, for example, case of appendicitis, where a family doctor thinks that, okay, now it needs to be surgically treated, at least examined, done, ultrasound has to be done. So that time he writes an Einweisung so that the patient can be admitted in the hospital. Überweisung is, for example, a specialist has to see the patient, but patient does not need to be admitted. So, for example, someone is having shoulder pain and there is a thought that he might be having a rotator cuff injury. So now in that rotator cuff injury, patient does not need to get admitted, but it has to be seen by an orthopedic surgeon and an MRI has to be done. So a Überweisung will be written. That's the difference between Einweisung and Überweisung. Many people get confused in that. Which one should one get? So for Facharzt, for a specialist examination, OPD, Überweisung is sufficient, and for inpatient treatment or diagnostic, Einweisung is required. Pflegeverordnung is the, as I mentioned in the previous slide about ambulant Pflegeversorgung, that means the ambulant Pflegedienst, patient the nurse or the Pflege person, he will come to the patient's home and take care of the patient. For that, a doctor needs to write this Pflegeverordnung. Wonderful. That was the short, brief idea about how the healthcare system in Germany works. Basically, about terminology system is not very complicated, but because of the missing terminology, we often have difficulty navigating the system. That was all from my side. Thank you very much.
Thank you. Thank you, Deepak, for sharing such a practical information. It looks very trivial, but still we know that when as a foreigner we land here, this gives some challenges and some people have challenges for longer time. So thank you very much.